Hello everyone, myself Dr. Akash Ganguly and the topic of my presentation for today is sterilization. Coming to the definition of sterilization, according to the Centers for Disease Control and Prevention, guideline for disinfection and sterilization in healthcare facilities, according to their update in 2024 June, sterilization describes a process that destroys or eliminates all forms of microbial life and is carried out in healthcare facilities by physical or chemical methods. Disinfection again describes a process that eliminates many or all the pathogenic microorganisms except the bacterial spores on inanimate objects. Disinfection is not sporicidal. Few disinfectants kill spores with prolonged exposure time. These take about 3 to 12 hours and are called chemical sterilants. Cleaning is the removal of visible soil, organic and inorganic material from the objects and surfaces and normally is accomplished manually or mechanically using water with detergents or enzymatic products. Decontamination removes the pathogenic microorganisms from these objects so they are safe to handle, use, or discard. All of these definitions have their origin from the CDC guideline for disinfection and sterilization in healthcare facilities. Now, what is a germicide? A germicide is an agent that can kill the microorganisms, particularly the pathogenic organisms. The term germicide includes both antiseptics and disinfectants. To recall what we have uh, learned till now, antiseptics are the germicides applied to living tissue and skin, whereas disinfectants are the antimicrobials applied only to the inanimate objects. In general, antiseptics are used only on the skin and not for surface disinfection, and disinfectants are not used for skin antisepsis because they can injure the skin and other tissues. Coming to Spalding classification, 30 years back, Earl H. Spalding gave a rational approach to disinfection for disinfection as well as sterilization of patient care items and equipments. He devised a classification which categorized these instruments and items for patient care into into three subcategories, that is critical, subcritical, and non-critical, based on the degree of risk for infection involved in their use. Now coming to the critical items, these instruments are such that they come in direct contact with the sterile tissues or the vascular system. According to a reference given by Peterson in the year 2011, these items are to be sterilized and made free from all the microorganisms. Some examples of critical items include extraction forceps, scalpel blades, bone chisels, periodontal scalers, surgical burrs, needles. Some instruments from the medical aspect are cardiac and urinary catheters, implants, ultrasound probes used in the sterile body cavities. Well, these instruments should be sterilized with steam. Those instruments which are heat sensitive should be treated with ethylene oxide, peroxide gas plasma, or by liquid chemical sterilants. They should have the examples include greater than or equal to 2.4% glutaraldehyde based formulations, 0.95% glutaraldehyde with 1.64% phenolphenate, 7.5% stabilized peroxide, 7.35% peroxide, and 0.23% per acetic acid, 0.2% per acetic acid, 0.08% per acetic acid with 1% H2O2. Semi-critical items, well, these instruments, they do not usually penetrate the sterile tissues, but they do come in contact with the intact mucous membrane. These items are made free from microorganisms by high-level disinfection. These are free from all the microorganisms. However, small number of bacterial spores are permissible in these instruments. As an example, we have endoscopes, amalgam condensers, air-water syringe, impression trays, dental handpiece, dental mirrors. From the medical aspect, we have examples as laryngoscope blades, esophageal manometry, probes, cystoscopes, anorectal manometry, catheters, diaphragm fitting rings. These require high-level disinfectants using chemical disinfectants. These include glutaraldehyde peroxide, orthothialdehyde peracetic acid with H2O2. High-level disinfectants, well, according to FDA, that is Food and Drug Administration, these are sterilant, which are used for shorter contact time to achieve a 6 log 10 kill of an appropriate Mycobacterium species. The non-critical items, well, these do not touch the patient directly or come in contact with the intact skin only. These items may be cleaned or disinfected by low-level disinfection. Examples are light arm handles, dental chair, dental X-ray equipment, chair-side computers, chair switches, bedpans, blood pressure cuffs, and crutches. Well, generally, mops are used for these, and to sterilize these, we require standard laundering, provided acceptable decontamination of heavily contaminated mop heads, but the chemical disinfection with the phenolic is less effective. It may be sterilized with steam as well. Well, single-use disposable towels impregnated with disinfectant also can be used for low-level disinfection when spot cleaning of non-critical surfaces are needed. Now coming to the instrument processing pathway, well, this cycle can be followed. This diagram has been taken from the AMSI book. That is the that is the book by the AMSI, that is the Association of Oral and Maxillofacial Surgeons of India. There is oral and maxillofacial surgery for the clinicians. Well, the instrument should be cleaned and dried in automated washer. These should be then packaged, sterilized, stored. Then instruments are used on patients. Then they are transported with optional pre-cleaning or holding, then rinsed and cleaned in ultrasonic unit. Coming to sterilization, there are two methods. One is the physical and one is the chemical methods. In the physical methods, we can use heat, which may be categorized into dry heat, where we have red heat, flaming, incineration, and hot air oven. In moist heat, we have temperature below 100 degrees Celsius, temperature at 100, and temperature above 100. In radiation, we have ionizing radiations like the X-rays and gamma rays. Non-ionizing radiations include infrared and ultraviolet. In filtration, we have depth filter, membrane filter, and air filter. Coming to heat, the most common and one of the most effective methods of sterilization. Well, these factors influencing the sterilization by heat are the nature of heat, whether it is dry or moist, temperature and time, the number of organisms present, whether these organisms have sporing capacity, the type of material from which these organisms are to be eradicated. Coming to the mechanism of action for these dry heat and moist heat. In dry heat, we find that there is protein denaturation. In moist heat, there is protein denaturation as well as coagulation. There is oxidative damage in the dry heat, and in moist heat, there is hydrolysis of the bacterial proteins. Now, if we talk about dry heat, the killing is due to the dehydration and the oxidation with protein denaturation. Red heat, here we utilize the aspect that the instrument should be placed over the Bunsen burner, like the sterilization of metallic objects, by holding them over this flame before until the time they become red hot. Examples are inoculating wires, needles, forceps. In flaming, the article is passed over the flame without allowing it to become red hot. Examples are glass plates and glass slides. Coming to incineration, the destruction of infective materials. Well, these are taking place in incinerators. These are soil dressing, bedding, pathological materials, and carcasses. In flaming, these are utilized in for glass slides. That is, over the flame, we pass the object multiple times so that it is used for sterilizing the media. The examples here are glass slides, scalpels, mouths of culture tubes. These are not allowed to get red hot. Now, red heat, as we have described earlier, that is holding the instrument over the flame of Bunsen burner, for instance, sterilization. Coming to hot air oven, it is used to sterilize items which do not get damaged by high temperature, such as laboratory glass, flasks, instruments with sharp cutting edges, BP handles, powders, tap and dishes, and mouth mirrors. These are easy to install with low operating costs, penetrates the materials, and non-corrosive for the metal and sharp instruments. However, the instruments are costly. There is low rate of heat penetration and microbial killing with time-consuming method. There are two types, actually static air type and forced air type. In the static air type, it is oven type sterilizer, which is slower in heating. The forced air type is a motor driven, which is more rapid in action. Coming to the temperature and the time period, for 160 degrees Celsius, time period of 120 minutes is utilized. For 170 degrees Celsius, 60 minutes are utilized. For 180 degrees Celsius, 30 minutes are utilized. Now coming to the control aspect of these hot air ovens, if we take the hot air ovens, the spores of non-toxigenic strain of Bacillus subtilis and Clostridium tetani are used as a microbiological test of dry heat. Brown's test strip are available that contain a chemical indicator as well. This is different from that of autoclave, which uses moist heat, where the control is uh, stereothermophilus. I'll be talking about this in my later slides. Now coming to glass bead sterilizer, well, in this the media used are glass beads, molten metal, and salt. Temperature is about 220 degrees Celsius. The method employs submersion of small instruments such as endodontic files, artery forceps, scissors, and burrs into the beads and are sterilized in 10 seconds provided they are clean. A warm-up time of at least 20 minutes to ensure uniform temperature in these sterilizers. Now coming to pasteurization, well, in this a temperature of about 63 degrees Celsius for 30 minutes, that is the Holder's method, or a temperature of 72 degrees Celsius for 15 to 20 seconds, that is flash method, is followed by cooling quickly to 13 degrees Celsius. The method used for heat-sensitive liquid and pharmaceutical products. Coming to Tyndallization, this was named after John Tyndall, where a temperature of 100 degrees Celsius for 20 minutes for 3 successive days was utilized. It is based on the principle that first exposure kills all the vegetative bacteria and spores. Since they are in a favorable medium, it will germinate and be killed on subsequent occasions. Coming to autoclave, here the moist heat is utilized. In this, the steam is the effective means of sterilization because of its high penetrating capacity. It gives off large amount of heat to surface with which it comes in contact. Autoclaves or steam sterilizers essentially consist of the following: a cylindrical or rectangular chamber with capacities ranging from 400 to 800 liters, water heating capacity, water heating system or steam generating system, steam outlet and inlet valves, single or double doors with locking mechanism, thermometer or temperature gauge, and pressure gauges. To achieve sterility, a holding time of at least 15 minutes at 121 degrees Celsius or 3 minutes at 134 degrees Celsius at 15 psi above the atmospheric pressure is required. To avoid corrosion, Crawford and Oldenburg recommended addition of ammonia to the autoclave. Steam sterilization is of two types. One is gravity displacement and one is dynamic air removal. Now the steam sterilization, here we use the control of spore of Geobacillus stereothermophilus that I was talking about in my previous slides while comparing the hot air oven with autoclave. So there is irreversible coagulation and protein denaturation. Now coming to flash sterilization, in this the unwrapped objects are sterilized at 132 degrees Celsius for 3 minutes at 27 to 28 pounds. Coming to filtration, it helps to remove bacteria from the heat labile liquids. As viruses pass through these ordinary filters, it can be used to obtain bacteria-free filtrates of virus isolation. The different types of filters are candle filter, asbestos filter, sintered glass filter, and membrane filter. Coming to irradiation, when radiation is used for sterilization is of two types. One is ionizing radiation, which includes X-rays, gamma rays, high-speed electrons. Non-ionizing radiation, which includes ultraviolet light and infrared light. These forms of radiation can be used to kill or inactivate microorganisms. Non-ionizing and ionizing radiation. In the ionizing radiation, we have X-rays and gamma rays. In the non-ionizing, we have extremely low frequency radio waves, microwave, infrared, and visible light. Coming to the ionizing radiation, these include X-rays, gamma rays, cosmic rays, which are highly lethal to DNA and other vital constituents. The mechanism of action is that they act by the formation of radiation tracks in the DNA of bacteria, leading to its death. They have high penetration power. There is no appreciable increase in the temperature, thus referred to as cold sterilization, which is an essential phenomenon. It is used for sterilizing rubber or plastic disposable goods, disposable syringes, and adhesive dressings. Well, if we go into the details given by the CDC guideline for disinfection and sterilization in healthcare facilities, we find that cold sterilization is the sterilization done by given by ionizing radiation, primarily by the cobalt 60 gamma rays or the electron accelerators. It is a low temperature sterilization method that has been used for a number of medical products like tissues for transplantation, pharmaceuticals, medical devices. There is no FDA clearing ionizing radiation sterilization process for use in the healthcare facilities. Because of high sterilization cost, this method is an unfavorable alternative to ETO and plasma sterilization in healthcare facilities, but is suitable for large-scale sterilization. Some deleterious effects on the patient care equipment associated with gamma radiation include induced oxidation in polyethylene and delamination and cracking in the polyethylene knee bearings. This is a disadvantage of these ionizing radiation mode of sterilization. Now coming to non-ionizing radiation, well, electromagnetic rays with wavelengths longer than that of visible light. Some examples are infrared radiation used for rapid mass sterilization of syringes and to purify the air. UV radiation for disinfecting the enclosed areas like hospital wards, operation rooms, and laboratories. Chemicals include phenol derivatives, phenol, cresol, resorcinol, chloroxylenol. Oxidizing agents like potassium permanganate, hydrogen peroxide, benzoyl peroxide, halogen like iodine, chlorine, biguanide chlorhexidine, quaternary ammonium like cetrimide and zephyran, alcohols like ethanol, isopropranolol, aldehyde like formaldehyde, glutaraldehyde, acids like boric acid, acetic acid, metallic salts like silver nitrate, zinc sulfate, zinc oxide, calamine, dyes like gentian violet, propylamine, acryflavin, furan derivatives like nitrofurazone. Ethylene oxide gas sterilization are of two types, mixed gas and 100% ETO. The most common ratio is 12% ETO mixed with 88% CFC. Four essential parameters for determining the ETO gas sterilization are the gas concentration, the temperature, the relative humidity, and the exposure time. So, some disadvantages are the lengthy cycle time, the cost, and the potential hazards to the patient and staff. It is used to sterilize heat or moisture sensitive medical equipment. ETO sterilization cycle has five stages: preconditioning, humidification, gas introduction, exposure, evacuation, and air washes. Alkylation of protein, DNA, and RNA takes place in this procedure. Hydrogen peroxide gas plasma, there is generation of free radicals, plastics, electrical devices, corrosion susceptible metal alloys. Peracetic acid sterilization, well, it denatures the protein, disrupts the cell wall permeability, and oxidizes sulfhydryl and sulfur bonds in proteins and enzymes. Now, some of the materials and the methods with which these can be sterilized: the inoculating wires or loops by red heat, glasswares like syringes, petri dishes, test tubes, universal container oily fluids with hot air oven, disposable syringes and other disposable items with gamma radiation, culture media with autoclaving, culture media containing serum, egg tindalization, toxins, serum, sugar, and antibiotic solutions can be filtered. Then milk can be pasteurized. Cytoscopes and endoscopes are sterilized with glutaraldehyde. OTs can be sterilized with formaldehyde as well as ETO. Infective material like soil dressings, beddings, animal carcasses by incineration. Skin can be sterilized with tincture iodine, 70% ethanol, and Savlon. aprons, gloves, and catheters, surgical instruments except sharps, by autoclaving, sharp instruments with 5% cresol. Some of the emerging pathogens nowadays are the Cryptosporidium, Helicobacter pylori, E. coli 0157 is to H7, Clostridium difficile, Mycobacterium tuberculosis, SARS for coronavirus, or bioterrorist agents. Bioterrorist agents are agents where the genetic material is modified and bioengineered to create a potentially pathogenic organism. Now, lastly, I would like to describe the resistance and susceptibility of some of the organisms. The point to note here is that prions are the most resistant organisms, and if we see the downward curve, we can find that vegetative bacteria or lipid or medium-sized viruses are the most susceptible ones. Thank you.